And we are back. I'm Matt Leck, David Griscom joining me. We are joined now by Ben Spielberg. He's the co-founder of 34 Justice and is currently with San Jose Unified. Ben, thank you so much for joining us today.
Thanks so much for having me, Matt. I really appreciate it.
So I think you gave voice, this weekend to frustration that I think a lot of us are feeling about the progress or lack thereof in healthcare when it comes to the Biden administration. Before we get into what was promised and what they're doing, can you just lay out what the left's demand should be and what makes the most sense if we had full control as the left?
Yeah, I think there's a pretty unified stance among social justice advocates that the right policy that we should be pushing for is a single payer healthcare system, commonly referred to as Medicare for all. I think the Medicare for all name can sometimes be a little confusing because people attach to it different views of what actually that means. And the current Medicare program is not actually what we mean. We mean an expanded Medicare program for all and an improved Medicare program for all, which would be single payer. But I think generally when people in the United States talk about what the healthcare system should be, it should be a system in which when you go to see your doctor, you are not relying on an insurance company to decide what sort of treatment you're going to get. The doctor is deciding what sort of treatment you're going to get, and then the government pays the bill on the back end. And they're covering it the same way for everybody so that if you're low income or if you're high income, you're still able to have the same access to care. So that's really what we mean by a single payer Medicare for all system. When Bernie Sanders talks about it, that's what he means. It's a system where you get to go to the doctor makes the decisions, and the government then foots the bill without you having to pay at the point of service and potentially going bankrupt because you need medical care.
Now, Bernie really set the terms, I think. All the healthcare policies during the primary were, I think, a reaction to his. Joe Biden won talking about things like public options. What exactly did Joe Biden and what were we promised from Biden and Democratic leadership?
So Joe Biden was very clear that he opposed Medicare for all during the Democratic primary, which is one of the reasons that I think a lot of progressives opposed his candidacy. But he did, and I think he was pushed this way because, as you said, Bernie really did define the terms of the debate on healthcare. He was pushed to really commit to, yes, I support a public option, meaning something that the government runs that individuals can buy into rather than necessarily having to purchase private insurance on the Obamacare exchanges, which we can talk more about. That's available not just to the low-income people who qualify for Medicaid or the older people who qualify for Medicare, but is available more broadly. He also voiced support during the campaign for, or at least receptivity to, and he has since said he supports lowering the Medicare eligibility age from 65 to an age below that. And some Democrats in Congress have really been pushing hard for it to be at least 50. So even though Biden has said he opposes Medicare for all, he has made pretty strong statements saying that he would support, and this was in his American Families Plan, for example, when he released it, a statement saying he supports it with no actual policy commitment behind it, but he's repeatedly said in rhetoric that he supports a public option or an expansion of the Medicare eligibility age.
Just talk about Biden rhetoric, because we've been calling him like the press release president so far, like where he'll release something like we're gonna stop arming the Saudis or something, or stop like offensive actions, and then you actually like, and that's like that press release seems kind of good, and then ultimately the follow through is just not there.
Yes, and and I think that this is one of the things that I was to some extent getting at when I was saying that Medicare for all can be a confusing name sometimes, because I think there were a lot of politicians, and we saw this again during the primary with, Kamala Harris, who had said and signed on to Bernie Sanders' Medicare for all bill and said in the past she supported Medicare for all, Elizabeth Warren, who had said she supported Medicare for all, and then you saw when the details came out, they didn't actually support a single payer Medicare for all system as Sanders had conceived. We're seeing a very similar and I would say more intense version of that with Joe Biden on a lot of dimensions. But on healthcare, you can really see it because the phrase I think that Bernie really popularized and did a great job popularizing, and it's great that people are saying it, is healthcare is a right. It should not be a privilege for all Americans. And that's something you will hear Joe Biden say. You'll see it in his written materials when he releases a plan. You'll hear Chuck Schumer saying that. You'll hear a lot of other Democrats getting out and saying, we believe healthcare is a right, not a privilege, which is why we support building on Obamacare, which is not actually a policy that backs the belief that healthcare is a right and not a privilege. So I think, to your point, it's really important to look at the policy details and not just the rhetoric that these politicians are speaking to, because when you look at the details right now, we do not have convincing evidence that Joe Biden believes that healthcare is a right, not a privilege.
And could you during the 2020 campaign, there was a lot of people who were getting worked up about the distinctions between like the Bernie plan and like, okay, well, that's great, but that's super progressive. It might not be practical, right? Could you just remind our listeners why the single payer system specifically matters more than just an expanded public option, like why that is the gold standard?
Yeah, absolutely. Well, I mean, I would say that there's really two reasons for it. One is that from an individual standpoint, it's by far the best for people who need care. So as I said before, what happens in a single payer system is if you're somebody who's sick, you're not making a decision, do I go to the doctor or do I make sure I can pay my rent check? You're actually going to the doctor to get your care because you know that the care is going to be covered on the back end. This is how it works, by the way, in most developed countries around the world. It's the point Bernie Sanders always makes. Like in other countries, when you get sick, you don't have to make that calculation of, is this something that I can actually go see the doctor for? The other piece, and I think that this is also very important about why, especially when we talk about a public option, like you said, David, we want to make sure that it's very clear if there's a public option, that it's a robust Medicare-like public option that really does serve really as an expansion of the Medicare program rather than a separate program in and of itself. And that's because, and I think everybody knows this, the American healthcare system is a total mess. It's got a whole bunch of fragmented parts to it. We have Medicaid, we have Medicare, we have private insurance through the Obamacare exchanges, and then we have private insurance that can be bought through employers and that people can be put on. And then lots of people, of course, don't have insurance. But that creates administrative inefficiencies. The public ends up spending way more money on healthcare overall when you combine private and public spending than it would if you just had one payer, the government, that was saying whenever care was needed, okay, we're going to foot the bill, because they can negotiate lower prices when it's one entity. And again, you don't have to deal with managing, okay, this person, they lost their job, so now they have to transition from this plan to a different plan. You need to navigate exactly what's covered under the new plan, whether the coverage is going to be from an in-network doctor or an out-of-network doctor. That's something that totally you just don't have to deal with if you have something like a Medicare for All system, which is, again, another reason that it's super important to transition to it.
And I just wanted to note this because I've had the opportunity to talk to a few doctors, medical professionals too, about this issue. And one point that was really striking to me recently, because I know I've been on the other side of this as a patient, is doctors should never be put in the position by their patients, if their patients saying, hey, I'm worried about paying for the bill, what tests can I not do? Right? Or what of these things, what are these prescriptions that you might be making that, I might need to be pursuing? Can I maybe skip because I'm worried about the cost, right? If you're somebody who wants to provide care for people, and that's basically the oath that you've sworn to society, that's an extremely difficult position to be put into. But it is one that many, many doctors are like having to face because they realize, the fear that many patients have when they enter into any kind of a medical setting, that a lot of people are worried that they're going to be walking out of there with mountains and mountains of debt that they'll never be able to pay.
No, that's 100% right. And, it's one of the reasons that I'm super passionate about this issue, actually. So I've done research on it. I used to work for the Center on Budget and Policy Priorities and worked on healthcare as one of the issues that I did research and writing about. But beyond that, I have a very healthcare focused family. So my sister is a nurse, my mom's a nurse, my wife's a doctor, my mother-in-law is a doctor, and my dad is a healthcare attorney. And then my other sister actually worked as a healthcare navigator when the Affordable Care Act was first passed, trying to help people get access to healthcare plans on the ACA exchanges. And uniformly, everybody in my family is a Medicare for All supporter. And the doctors and the nurses, precisely for the reason that you just mentioned, David. I was actually just talking to my sister a little while ago about the fact that as a nurse, sometimes they'll recommend certain treatments for patients, but they have to use a different treatment that the insurance company will cover before they're allowed to use the ones that the a medical team recommends, which is just an insane way to have a healthcare system.
So yeah, absolutely. We've talked a little bit about what Biden promised. Where's he going, barring some sort of intervention politically by the activists in the left?
Yeah, so if you've been following the news recently, you'll see that there's kind of two things that are getting pushed through Congress right now. There's this bipartisan infrastructure bill, which is likely to be pretty small bore and have some unfortunate elements to it. And then there's what Democrats have said could be a $3.5 trillion reconciliation package, which means that they don't need to worry about the filibuster if they push it through and could pass it entirely with Democratic support. This is the second bill that Democrats are going to pursue that way. The first was the American Rescue Plan that they passed to kind of stem some of the effects of COVID. And it is the second bill where the Biden administration and what they've laid out, again, has nominally said, we believe healthcare is a right and not a privilege, but has said, actually, yes, we support the concept of a public option. We're open to Medicare eligibility expansion to individuals under age 65. But the only thing that we're putting in this plan is an expansion of the Obamacare subsidies in the Affordable Care Act, which basically means that the government would pay insurance companies more so that individuals who buy insurance on the Obamacare exchanges get to pay less in premiums when they want to get healthcare on the Obamacare exchanges. So that was the big investment that the Biden administration made in the American Rescue Plan, which they passed several months ago. They made it temporary. So one of the elements of the American Families Plan that kind of is the core piece of what they want to do on healthcare is make those permanent, those subsidies permanent that reduce premiums for individuals on the exchanges. And then they also have a nominal commitment, at least in this bill, for something that is a progressive priority and matters, which is an expansion of Medicare coverage to dental, vision, and hearing. So right now, under the Medicare program, those dental, vision, and hearing are not covered unless you have a Medicare Advantage plan, which is basically a private plan through Medicare rather than the fully public way that Medicare should be. And so this has been a Bernie Sanders priority. It's been a Pramila Jayapal priority, expanding Medicare to cover dental, vision, and hearing. And so that is important. And that's an element of what they have in here, but it's not enough. I mean, in a $3.5 trillion bill, progressives should be demanding a robust expansion of the Medicare program. I mean, I think progressives should always be demanding Medicare for all, but at the very least, we understand Joe Biden is president. He's not going to support that. We should be demanding it, but what we should be able to extract in the negotiation is definitely some sort of expansion that he has already said he supports. And thus far, it looks like Democrats are not going to do that.
Yeah, I heard a cynical interpretation that I want to run by you about that, because I think it's great to expand those benefits, but the complaint was, if we're expanding this, it makes it less likely that we're going to lower the age, for instance, and make it more inclusive. Like, what do you think about that?
I don't really buy that. I mean, I think an expansion is a win, but I do think it's a less significant expansion than the age eligibility expansion, because your political constituency is still roughly the same. You are improving Medicare as a program. So that's why I do think that it doesn't take the pressure off for getting the age expansion, because what it does is it makes Medicare even more popular than it is today, right, because it's an even better program. So I don't think it hurts you to get the expansion of dental, vision, and hearing at all, but I don't think it's as significant as getting an age eligibility expansion. And again, we have 17 senators on record with a letter to Biden saying they want this. We have 156 House representatives, Democrats in the House of Representatives on record saying to Biden that they want this. There's really no reason it shouldn't be a non-negotiable portion of this bill. And I think progressives really need to demand it and say they're not going to vote for the bipartisan infrastructure bill or for the reconciliation package unless it includes this sort of expansion.
Yeah, and politically, I mean, it just seems like an easy sell to folks as a more robust and then potentially more expanded Medicare is something that would be attractive to a lot of people who, not to be too cynical about this, who do show up and vote, people who are sort of on the cusp of those programs, right? This isn't, something like, student loan debt relief, right? That, is very important, right? But that affects like a specific like age group in the country. Like this one very much affects a lot of different folks, but specifically an age group that you would think is part of the Biden, team Biden on some level.
Yeah, there's definitely no political downside from a constituent perspective and a public popularity perspective to pursuing an expansion of the Medicare program. When you look at polls on Medicare and even Medicaid popularity, they consistently poll at least as well, if not better than private insurance, in many cases better. And then when you propose changes to the Medicare program, things like the expansion to dental, vision, and hearing, the expansion of the eligibility age, overwhelmingly popular, have majority support among Republican voters as well. Interestingly, Morning Consult actually polled somewhat recently a bunch of the different healthcare ideas that Democrats had been talking about. They all had majority support. The only one that did not have majority Republican support is the signature one that Democrats have been pushing, which is the enhanced subsidies on the ACA exchanges. It still had majority support, but it is less popular than every expansion to Medicare. So there really is no political downside. The only reason to oppose this really is if you want to give the insurance companies a continued really profit generating machine in terms of the insurance system that we currently have. And that is the problem with Democrats. I mean, I don't think, I would say personally, my view on this is generally that Democrats don't have any interest in reducing the insurance company take. I think you could much more charitably say, they're scared of fighting the insurance industry, but either way, they have not demonstrated, at least leadership has not demonstrated any sort of willingness to go to bat against the insurance industry. But that's the only constituency they're helping by not doing this.